So your doctor, or you may just have noticed some asymmetry in the way your baby looks, or head shape. Torticollis or plagiocephaly is what they call it professionally. And I want to show you what you might look at your...
What is asymmetry?
Oh, unevenness. So if you notice some unevenness, your baby's only looking to one side, or unevenness in their head shape, they might have what's called torticollis or plagiocephaly. So what is your physical therapist going to look at when you bring your baby in for an assessment? I'm Kelsey Boss, pediatric physical therapist, founder of Compleo, and mom of 2 boys. So we're going to look at range of motion to see both passively and actively. So if the baby has full passive range of motion, it means there's no joint restrictions, but there might be some differences in muscle strength side to side. So this is called a goniometer. And so they may put it down to kind of see what position your baby rests in. Hey, buddy. And kind of his range of motion tilting side to side. So we're getting about the same on each side. And then we're also going to look at how they look from side to side. So we're going to look actively, how they move their neck. Good job, buddy. Can you go this way? Way to go. Way to go. And see if there's any differences in active range of motion from side to side. But they're not going to look just at the neck and head. We're also going to look at their trunk. So we're going to look and see if there's any differences in their lower body as well. So you can see here we go really easily. Here, almost as far. And he doesn't really have torticollis, so this is kind of just some assessments, but we might not see the differences we might see in some other babies. So we're going to look at how their hips move. We're going to check hip range of motion. And then, whoa. We're going to do a lot of feeling with our hands to feel different muscles through their neck and back. So we're going to look and see if there's skin creases on their neck. We would maybe take their clothes off to see skin creases on their back. We're going to look at their developmental skills. And so it's a lot more than just, do they have the range of motion or not? We'll be checking to see if they're on track with their skills, if they're performing their skills evenly side to side, and if there's any changes in head shape. So we'll look from up high and different angles. So if you are looking for a physical therapist, make sure they're checking your baby out from head to toe and not focusing just on the neck, giving you things to look for and work on at home. And they will be looking to both sides in no time. Yes?
With torticollis, what is bad about it, or what can it lead to?
What?
Why does it need to get treated?
Very good question, Mr. Compleo. Yeah. Mr. Compleo in the peanut gallery there. Yes, a lot of doctors are going to say wait and see, and there's actually new practice guidelines out that I cannot wait to nerd out on. But one of the really important reasons we need to treat it is to make sure they develop their muscles evenly on both sides of their body. So if we're not treating that torticollis, you may see differences in strength, which could come out as walking a little bit differently, only wanting to use one leg to do the stairs, skipping milestones, like skipping crawling, or crawling in different abnormal, not typical patterns. And then it can also lead to those changes in head shape if they're not already there. And that can affect how sports helmets fit, how glasses fit. It's much more than just a cosmetic issue. Research shows the earlier you treat it, the faster it's going to get better, the more likely it's going to get resolved, and the less therapy you're going to need, which means the less money you're going to spend. So if you are concerned about torticollis or plagiocephaly, don't let your doctor tell you to wait and see. Find a physical therapist who will check you out.
What is plagiocephaly?
Plagiocephaly is changes in head shape. So that's when there's a flat spot in one part of the head. Any other questions, Mr. Compleo?
Possibly, but I'll ask him at another time.
All right. And does anyone else have any other questions?